Shocking report into the state of England's maternity services, which has found allegations of racism, bullying and the misclassification of baby deaths. Earlier today, I spoke with Leonard. She's the Deputy Chief Midwife at the Royal College of Midwives, and I started by asking her whether this report reflects the reality.
This report comes, unfortunately, after a decade of reports that we've had already and a significant number of findings. And what we really need to see now is action from this report. It highlights the systemic findings that we already know from previous reports. And now the time really is for the government to act on the findings from this report in terms of the task force in the future.
Yeah, the full findings will come out later in the year, but Baroness Amos wants to show transparency and that they're moving at pace. Such is the nature of maternity care in the UK, in England. Midwives, of course, the other major stakeholder in this, because, of course, we do talk about mothers and babies and the outcomes for them under maternity care. What is it in particular that you felt midwives have put across throughout the course of this investigation?
I think for midwives, it's about the fact that this has been long-standing issues that have been raised by midwives, by MSWs for a long time, and it highlights the systemic understaffing, the poor estates that the midwives and maternity support workers work in, that women and families are having their babies in, and despite recommendations and supposed investment in that, it has remained unchanged.
Our guest on our show tonight, Gabriella, who went through her own birth trauma and has told her story on Sky News, said that, you know, she was in a delivery room with around 18 people and no one was aware she was close to death because of the amount of blood she'd been losing, because the staff were not adequately trained. Is that a real danger that, you know, the staff, midwives, obstetricians, the maternity care unit is stretched so thin that women are being put at risk because of staff being improperly trained in those emergency scenarios?
The training is really important to any healthcare professional. The training that midwives get is a 3 to 4 year program, and at the point of registration, they come out capable and able to be a midwife, and are fantastic in the ability to do that if the environment that they work in enables them to do that. And what that means is that we need to have the right amount of midwives to be able to support the students when they're learning in practice, but also following that, we need as midwives to be able to consistently and frequently have the time to train as part of the multi-professional team. And without safe staffing numbers, what we find is that actually we don't have the time to be released from clinical practice. We're being pulled off of that training frequently to deliver, just to even experience and receive a bare minimum of mandatory training that we need to have. And that's got to change.
I just wanted to pull out some quotes from midwives that spoke to Baroness Amos. What are the quotes? "Please, can you tell them we need help to put pride back into our profession?" One midwife telling the inquiry, "I feel embarrassed to say that I am a midwife now." How do you put pride back into the profession?
Morale for midwifery, for the profession, has continued to plummet, and that's not surprising given the decade of reviews that we have. And it's imperative that the impact of Baroness Amos's view and the ability for it to be a conduit for the change that is much needed. I mean, the difference this report has in terms of action is incredible if that action happens in a sustainable and funded way. And what that enables us to do is evaluate those changes and gives us opportunity to put pride back in the profession.
Hannah, a number of shocking findings that came out today that I wanted to put to you. They're uncomfortable. There is evidence from some families that said that baby deaths were being misclassified to prevent further investigations, and families telling Baroness Amos that their babies were designated stillborn instead of dying after birth. The families feeling that the system incentivised the recording of deaths as stillbirths, as this prevents the case from being investigated by the coroner. And we know that the NHS faced an estimated £27.4 billion in payments for maternity negligence in England since 2019. So there's some serious and really upsetting allegations from families to this report. I just wondered what your response to that was.
I think throughout the the decade of reviews that we've had, we've seen a significant amount of focus on investigations and learning and improving that accountability of care and the learning when the care when we have poor quality care or women and families are harmed. And what's important there is that we still continue to utilise those investigation mechanisms to make sure learning happens. And sometimes the focus is too much on the investigation and not enough accountability on making sure that learning happens in practice. And we need the time to be able to do that.